pleasure to welcome all of you here with us today. Today we are having our first in a series of community conversations on coronavirus and your mental health. As everyone knows, we're in the midst of a very uncertain time due to the presence and the spread of coronavirus. The news, the surrounding uncertainty, social and physical distancing, worrying about your own health or perhaps the health of others, sheltering in place, and social isolation are more than enough to cause concern, anxiety, depression, and just sheer worry. And now we also may have heard the stories of many COVID-19 survivors who are speaking not only about the physical elements of the illness, but as well the mental impacts of the disease in the form of depression or lack of clarity and confusion. This virus, as we know, is unprecedented, and it's causing unprecedented concerns and responses. Its impact is not just to a person individually, but as well to entire communities, the entire 50 states in the US, and to the world. This disease does not discriminate, and it seems to know no jurisdictional boundaries. That's why today and for the next few days, we'll talk about that in a moment, we're offering a series of webinars that complement our mental health series entitled Not All Wounds Are Visible. And this is dedicated to the issue of mental health and wellness in this time of coronavirus. Today's discussion is titled Protecting Your Mental Health, and it's meant to be a general discussion about mental wellness at this time. There will be additional topics that I'll share with you at near the very end, which will discuss additional issues, and that'll be on next Tuesday at 3 and on next Thursday at 3 as well. A little bit of logistical information before we start. This presentation will provide general wellness information and tips. It is not a substitute for medical advice, and if you need that, please do reach out to your healthcare provider for specific guidance and recommendations. There are additional resources available to you on our website at ums.org/coronavirus on this topic, mental wellness, as well as many, many others. Our presenter today, and I'm pleased to introduce her, is Dr. Connie Knowles. She's a board-certified psychiatric nurse practitioner at the Upper Chesapeake Health System. She's been with the University of Maryland Medical System for quite a long time. She's a national thought leader and a national advocate in psychiatric nursing. She chairs the Recovery Council of the American Psychiatric Nurses Association, and she has been on the ground with disaster events for quite a number of years and in quite a number of instances, to include being on the ground following 9/11 in Shanksville, Pennsylvania, after the crash of United Flight 93, and then subsequently on the ground in New York. She's also been deployed to work following the Oklahoma City bombing, the major earthquake in Los Angeles, and when I met her, Hurricane Katrina, among others. And so we're really very happy to hear from her. One more thing, toward the end of the presentation, we'll share some resources with you that may be of import and of value to you. And we'll also be able to take questions. If you'd like to type them out in the chat line, we'll try to take it and answer as many of those as is possible. So, Dr. Knowles.
I'd like to thank you, Donna, for hosting this presentation. I think it's very dear to my heart, and I'm very pleased to be here this afternoon. And what I'd like to have as my goal today is to talk about some of the things that I've seen and learned from responding in other disasters. One thing that's really different this time is that in most situations, I would find myself sitting with someone and talking to them and inevitably holding their hand. And what I'd like to suggest for this afternoon is that I'd like to reach out and hold your hand and give you some tips about things that I've come to really understand about what's normal and what can be done in these kinds of really uncertain times. The first perspective that I think is really very, very important is that this is different than other disasters because it's something that we're all feeling at the same time. We're all going through the same similar kinds of things now. And it's not certain where the end point is or what the end point looks like or what the road back to normal looks like. And so that means that it's even more important now to understand and to really take hold of the fact that fear and anxiety and actually other negative emotions such as anger and frustration are normal reactions in a very catastrophic, potentially not normal situation. And it doesn't feel like it is normal. It feels perhaps like you may be losing control, or you're fearful of losing control, or you just want to find some sort of peace that you don't feel is available to you. I can assure you that everyone has had those moments, including me, and that these kinds of strong emotions are very normal, and there are ways to cope with them. And the other really important perspective, and I have seen this many, many times, both in disasters and in my everyday life work, is that people and individuals are very resilient. And the human spirit is really not something that can be squashed. We come through, and we come through with hope. We come through with new ideas. We come through with better ways of perhaps dealing with things that we were always struggling to deal with. So can I have the next slide, please? Did I get the next slide? Can you hear me?
We have the slide on self-care up. Can you see it?
I'm sorry. Well, I will just move on, and we will talk about what's on the next slide, which is all about self-care and maximizing healthy choices in certain areas that are really essential for you to be confident about taking care of yourself. And the first thing that I have on that list is sleep, because I think getting adequate rest is one of the things that everyone can do to maximize what kind of mood they're in. Because as we all know, when you have a night of poor sleep, it affects how you can function the next day. All of the self-care elements have to do with you feeling like and being able to function in as your best self every day. And sleep is on the top of the list. The next thing is to make sure that you make as good as choice as you can make in terms of healthy food and nutrition choices, and drinking adequate amounts of water and fluids. This is really important because we have a stress hormone that's cortisol, and it is the one that typically gets us ready for fight or flight. And when that hormone is released in our system, it unless you do something to rid yourself of it, it can linger and cause you to feel worse later. So the two ways to get the stress hormone flushed from your body is to drink lots of water and lots of fluids, and to exercise, which is my third thing. But before I moved on to that, I want to say that as you're trying to get adequate fluids, I think you should watch the amount of caffeine, and you should watch the amount, if you're an adult especially, to avoid drinking too much alcohol, because those things can disinhibit and make for more problems later. So first is sleep, then there's good nutrition as much as you can manage, and then there's movement and exercise. And it's really important to walk if you can. It's not necessarily the time, if you've never been a person to exercise and you have other health conditions, it's not the time to start a rigorous program without contacting your health provider. But it is a good time to make sure that you're moving around, walking. Some people have been walking up and down the stairs a little bit as a way of getting exercise. If you are able to walk in your neighborhood, walk around your house, maintaining the appropriate physical distance, those are things that are important, as well as for children to feel like they have some rigorous playtime. So those are, now talk a little bit about getting things done. So I'm all for, oh good. We're down to the fourth thing on this list, which is getting things done. And what this refers to is having a schedule, keep some normality in your day, and perhaps doing lists. But I want to say this about that. I think those are good things to use in a planning sense, but don't beat yourself up if you're not adhering to everything in the list, because everyone is going to have moments of feeling perhaps like I can't get this done right now. So what I'm suggesting is that you give yourself a break, you allow yourself room. Perhaps your agenda or your schedule for the day was too rigorous for you. So if you get one thing done out of 5 and it's the most important thing, then congratulate yourself for getting that done and move on and try to tackle more the next day. The same thing in terms of perhaps children adhering to a schedule. And perhaps they balk at this or rebel against this. And what I would say is that they also need some slack. Do they need time to maybe have a little more exercise? Is it time to really talk about some of the feelings? Or, don't get into major conflicts over scheduling. Regroup, rethink, talk about it, and perhaps move on in a different way, allowing everybody what everyone needs now, which is a little bit of understanding that things aren't normal and that we are working towards a normal. The next thing on this list has to do with enjoying what you can and not forgetting to have those special moments and savor them. And if it's, I have more suggestions about this in a couple slides from now, but it's important to know that even in a time of high stress and uncertainty and high emotions, that it's okay to have humor. It's okay to enjoy things as you can. And so thinking about what activities are enjoyable to you is something that everyone can do. Now, one thing that's really important is feeling like you are connected. So you would try to maintain all the connections that you currently have, family, friends, acquaintances. I know that, you do have to sort of have some cautions about social media. But one thing that I have found from social media is that I was able to enjoy some moments last Sunday when my family celebrated Easter. We did it very differently, but I was able to connect with my kids, see my grandson, have what felt like somewhat normal conversations. And I've also enjoyed friends groups that I have on social media who are providing support. So I would say if you're using social media to connect, you are allowed to ignore anything that you see as negative and destructive and focus on the things that you find inspirational, funny, supportive, and focus on those things. A couple other things is that in terms of your choices and your self-care is to make sure that if you're on medication that you keep taking it as prescribed and you keep your supply so that you don't run out. And Along with that, staying in touch with your healthcare provider, especially if you are having any kind of symptoms or you're having a worsening of symptoms. There are lots of telehealth services that are being offered uh, by primary care physicians and people in mental health and behavioral health. There are people that are available to help you. So I'd like to move to the next slide. But if we have a little trouble with that and it takes time, I can move on to say that the other thing that is actually elaborating on the enjoyable activities, which is discovering and reminding yourself of what activities are soothing to you. And they're very specific to you. So that if you think about what nourishes your soul, one of the things that first comes to mind for me is music. And I enjoy hearing some old songs. I enjoy moving around a little bit and dancing. Music is something that I find very soothing, and I think a lot of people do. So play some old music, play some new music, play what you like, but soothe yourself with that. Most typically, I think people do turn to prayer and meditation, and those are things that I can't say enough about, especially if those are things that you normally find solace in and they are helpful and comforting to you. Reach out to your religious community, reach out to your pastor, priest, rabbi, um, and don't be afraid to reach out as in a new effort if it's something you haven't done and you feel the desire to do that. These are times when people sometimes question their basic faith and their religion, and that's okay too. And sometimes talking to some person that you respect, and it could be someone that is clergy oriented, or it may not be, about what you believe and um, what you're afraid of, and looking for the lights at the end of the tunnel. Those are things that you can reach out and seek help for. Meditation is something that people use partially or totally, and they are proven to show that they can reduce stress. Um, some people find that yoga is very helpful. Some people find that walking through something that, if you have the ability to walk through a park or walk through woods or find your favorite place, they find a peacefulness there. And those are things that can be done. Other people might like to garden. They might like to clear out even, a flower pot on your porch to get ready perhaps for seeds or some kind of planting. Um, it could be that you decide to clean out a drawer or clean out a closet, or you do some kind of painting. It could be change the oil in your car, but something that makes you feel like you're accomplishing and feels soothing to your soul. You know what those things are. I don't know what they are, but I would just encourage you to do that sort of thing. Maybe you decide that you may have not had time for something, and now you have a lot of time on your hands. And so maybe digging out some activity like crocheting or puzzles or something of that nature would be helpful. And if you have others in your house with similar interests, playing games as a family, something of that nature could be very soothing to you. Now, I want to talk just a bit about people who may be more vulnerable to these kinds of stressful times. And they would be people who are already in treatment, individuals who have physical challenges, people who have symptoms from medical conditions, not necessarily related to the virus, but who are coping with things like chronic pain or uncontrolled diabetes or other things. And what I'd like to say is that most of us are not really cognizant of the obstacles that people who are vulnerable in these ways, most of us are not necessarily aware of the obstacles they face every day without all of this. So now they have all the stress of different obstacles on top of the obstacles they already have. And so they may be more vulnerable. And again, what I said in terms of self-care and reaching out to your health providers, making sure you don't run out of medications, making sure that you ask for help when you need it, those are really, really important. One other thing I would like to say about vulnerable groups is that there are people out there who have problems with alcohol and substances. And what I'd like to say is that it's always a good day. Now the slides have caught up with me. It's always a good day to decide that you want to be sober. And it's always a good day to decide that you want to be sober again. And you may not, you may decide that the virus isn't going to be an obstacle and you're going to seek help because you can't do this anymore. And we do have information about how you can get help following my remarks, but I would just like to congratulate anyone who's celebrating sobriety and congratulate you for your continued sobriety. And that if you decide that today is the day that you want to take a different direction, go for it. So in closing, what I have as prepared remarks, I wanted to say, and look at that, the slides have caught up with me. What we're doing now is we're in the process and we're in not only transitioning into the disaster mode of coping with the virus, but we're also struggling, I will say that, to find and discover what our new normal is. Because I want to acknowledge the normality of this situation as well, because life right now is different. It feels different. It looks different for many people. And so it is already new. And in many ways, we have already adapted to things that we never expected to be doing 4 weeks ago. So take a moment to congratulate yourself on all the modifications that you may have already made, because we have all taken some really interesting, unprecedented steps to try to, as they keep saying, flatten the curve. And the other thing I want to acknowledge is that change is hard and that it happens by taking small steps. And sometimes I want to say that moving forward feels like you're standing still. It's okay to stand still. Just keep taking the small steps and moving forward. And there's just one other thing I want to say, and that is that, and it gets back to the idea of, people sometimes ask me, what is normal? And what I want to say is that what is normal is what is normal for you. There are definitely things that are not socially acceptable. There are things that are against the law, but there's no universal yardstick that anybody in my profession uses to measure normal. We measure normal by what's normal for you and what's out of character for you. Right now, everybody might feel and have moments of feeling out of character, and that's okay. Donna's going to give you some resources and some things that you can connect with, and I'm going to be around for a few more minutes to answer questions. Thank you very much.
Dr. Knowles, thank you so very much. That was a lot of really helpful information, and I'm sure people got a lot out of it. Before I start to talk about resources that are available to you, I'd like to remind everyone that you can type your questions. We do have a few that have come in already, but if you have questions, go ahead and type them in the chat line and we'll try to get them answered for you. First, let me talk a little bit about some general community resources that are available. the University of Maryland Medical System has stood up a nurse call line that's available 24/7. It's staffed by 4 nurses continuously, and quite a few people are now using that line. Many questions come in about the disease itself and what to expect, but you can also get additional information there, and that number for those who are just on the phone is 1-888-713-0711. We also have a very robust website available at ums.org/coronavirus. So there's a great deal of information generally about COVID-19, about how to get help. There's information about your mental wellness there as well. Next slide. Also, certainly in Baltimore City and beyond, you can go to Maryland and dial 211, which is stood up by United Way for general information on a number of things. If you want general information and help and assistance, you can always go to the National Alliance on Mental Illness, and that's NAMIMD.org. Or there's also information generally on the Maryland Department of Health website, and there are pages there devoted to COVID-19. Next slide, please. Here are some resources that may be specific to particular issues. Dr. Knoll mentioned a moment ago substance abuse. So if there are substance and alcohol abuse concerns, you can go to SAMHSA, SAMHSA.gov to find treatment information. Also, there's the Suicide Prevention Lifeline, 800-273-TALK, T-A-L-K. If there are issues or concerns related to domestic violence, you can get a great deal of information on the Maryland Network Against Domestic Violence. That's MNADV.org. They have multiple pages about resources, but in particular, if you go there, you can look up by county where you can get assistance in your particular county if you need it. And if there are issues concerning child abuse that have come to the fore, you can always go to the Maryland Children's Alliance.org. Next slide, please. Again, reminder that you can frame your questions in the chat line. I mentioned at the outset that this was the first of several webinars on mental wellness. We have 2 coming up next week. On Tuesday at 3, we'll be talking about how to help children cope. As you can imagine, there are quite a few things that children are going through. They're out of school, they can't see their friends potentially, they can't see their relatives. So we'll have a discussion, as we did today, on that issue in particular. And then on Thursday, again at 3, and you can use the same website, the same link that you used to get in today, we'll talk about isolation and what that means and how to stay connected and how important that is to mental well-being. All right, next slide. At this point, we can take some Q&A, Dr. Knoll, if you don't mind.
Sure.
I have one question that's come up, which says, is it unusual to feel like the days run together and to have disrupted sleep patterns?
So as I suggested, absolutely to lose a sense of time and perhaps feel like every day feels like 3 days long, or a week goes by and you think it's been a month long, or sometimes you look back and you look at the time and you just thought it was 5 hours ago. So sometimes the time feels like it moves very quickly, and sometimes it feels like the time is moving slow and that the days and weeks are much longer than they are. I think these are normal reactions to feeling somewhat overwhelmed and somewhat anxious. And I think that having some kind of sleep disturbance is also something that can be expected. I think that your body has a point of exhaustion, and don't worry if you don't sleep for a couple of days and then you sleep really well, because I think that's just the way we normally address feeling this much high emotion.
Thank you. So you spoke quite well to the issue of normal is what's normal for you. But there is a question that says, is it normal to feel burned out after several weeks of sheltering in place?
Yes. And I also want to say, I think that one of the gauges you can use for your own self is that when you start to feel perhaps numb and perhaps like you're not feeling or responding to things as you normally would, that may be, or you feel very irritable and short with people, and maybe you snap and show anger and do things like that. Those would be signs for me. And what I would advise at that point is that you reach out to people that you trust and you talk things over. And you also take a break. Uh, Take a break if you need to from too much media coverage. Take a break from too much news. If you want to watch old movies or Harry Potter or something like that, or something that makes you really feel like distracted, do those things. But I think having those kind of feeling of burnout is a sign that you need a little help. And usually people get that help first by talking to those who they trust, they love, they are friends with, their family. And if those things are not available or they don't work, I would say that would be the time perhaps to think about reaching out for some professional help.
Thank you. There's a question here that says, do you have any suggestions regarding mental health that apply to men versus women or different age groups during this pandemic?
Well, certainly there are lots of specific things to do that are different and have to be age appropriate for children, including how people, parents and others talk to children and explain what's going on and perhaps deal with their anxiety. Um, Men and women have differences. Um, I think that what I have seen in other disasters is that sometimes men have more difficulty crying and expressing their feelings and emotions, but that's not a given. That's not always true. But for some men and some age groups, it may be more difficult. Uh, but I think that to give people and to give your loved ones permission to have moments where they don't have to feel like they are strong. I mean, we're all human, we're all vulnerable, we all have the whole gamut of emotions, and it's okay to experience these in times of high stress. Those are the two things that would come to mind. I think that um, sometimes people underestimate older individuals, but individuals usually have this reservoir of things that they have done before to cope with things that perhaps others have not experienced. So sometimes an older individual actually has more perspectives. And what comes to my mind at this second is listening to my grandparents and parents' generation when I was young. They used to talk about the Great Depression, and they used to talk with my Italian heritage. They used to talk about one person had a pound of spaghetti, one person had a pound of ground meat, one person had some tomatoes, and they would make dinner. And to hear them talk about that made it sound to me like it was just great, this great, wonderful time. But I would say that our older individuals might have some secrets and some things that would help others. The other age group I would say that may have a lot of difficulty with this is adolescents, particularly people who are getting ready to go to their proms, getting ready to graduate, and those plans are very different right now. Um, I think, again, encouraging people to talk about their feelings, to express themselves, to think about creative ways for substitute kinds of activities that maintain whatever physical distance might need to occur, there's still many ways to celebrate, even though we have physical distance and concerns about keeping the spread of the virus down.
There are a number of questions coming in. Several relate to providing the slides. We will not only make the slides available to you, but we will make the presentation available to you on a website that I will share right as we are about to conclude. I have a question here. It's long, so I'm going to read only part of it, which says, do you have any suggestions for how to deal with someone who's already on anxiety meds and is now out of control? And it goes on to say there's some issues with controlling family members, requiring them to shower very often, not letting anyone in the house, requiring people to go through the garage even when they're just outside to get the mail.
So I think that's an excellent question. There's a lot of complications, I think, in trying to answer that in a very specific way. But what I would say is if you have awareness or knowledge of a loved one or someone in a household that may be conducting themselves in an unsafe way, in that they are endangering themselves or endangering others, that we still have the psychiatric emergency system operating, and that authorities can be contacted, and there are ways to the emergency rooms and urgent cares are still working to handle people who are having out of control behaviors, and there is still treatment and resources that are available to those people. I think that what I've seen in practice is that people who have depression and anxiety and other symptoms are perhaps having some worsening of their symptoms, and we are reconnecting, we are sometimes readjusting medications, but help is available. And perhaps we can give some more specific direction on dealing with an emergency petition situation or something of that nature when there's more time or in an addendum to this.
Okay, I'm just going to take a couple more questions, but I would want everyone to know that we'll try to keep these questions and provide answers on the website that I will give you in just a minute. I have a question here that says, I have an existing medical condition. Is it normal to be anxious because of the idea that all doctors are preoccupied with the virus and the ERs are the only means of reaching out? I think the question really is, where do I get some help if I think everybody's just preoccupied with the virus?
Well,
with that if you need.
I think that from what I understand, there are resources available. There are many. I think there's a real difficulty right now in being a new patient for a primary care physician, but there are resources available, and I think that would be a good the 211 resource that you can call, which is the Maryland resource, the general Maryland resource. They perhaps could help people with that. Most or very many of the primary care physicians that my organization works with, we have compiled lists of what different offices are doing, and there's been a dramatic conversion to telehealth kinds of services being available. And I think that that's a really good question, and I hope that I've given some direction for how someone could proceed with that.
If I may, let me just add to that just a little bit. We want to also be sure that everyone knows that if you have a pre-existing or a new medical condition that arises that you believe is serious, the emergency rooms are still open to you. We suspect that there are people who think emergency rooms right now are only for COVID positive patients, and that is not the case. We wouldn't want anybody to stave off their medical care and have something that's easily solvable now become an escalated problem in the future. And I would emphasize what Dr. Knoll said about telemedicine and telehealth. We are expanding our capacity, and the state has been very helpful in relaxing some of the rules and regulations related to telehealth so that we can provide people the care that they need in their homes. So I would say, please don't hesitate to reach out and try to get the help that you need. All right, we'll take one final question before we have to end in just a couple of minutes, and then I'll give you that website and you'll be able to see this again, get the presentation for more answers. And that is, someone has said, I just feel very angry all the time about this pandemic. What do I do with those feelings of anger?
Well, my best advice for anger and that kind of frustrated energy is please find an activity that's constructive and channel that energy into that activity. It would be good if it could be a physical activity. So if you can do some sort of workout, do some sort of thing where you expend energy, I think that would be useful. The other thing I want to say again, and I feel like I've said this many times, but I think that having anger, a lot of what we're dealing with is a little bit like the grief process, because we're grieving kind of what was normal a month or two ago. We don't necessarily have those things now, and it is frustrating. People are frustrated with perhaps their finances and worry about that, and it is it's not a small item. So I want to emphasize again that it is normal to feel this way. What you do with it is what will propel you in a positive way forward. And you want to think about doing that as opposed to something that is more self-destructive or that damages your relationships, that has the effect of making things having more stress. So any way you can channel those kind of negative, strong emotions like anger or frustration to make it into something that's more productive or that spends energy, that you can distract yourself with something else, would be to your advantage.
Dr. Knoll, I want to thank you sincerely for all of the information that you've shared with us. It's been very, very helpful. And again, let me say to everyone that you can get a recording of this webinar. It'll be up within the next 48 hours. And for those who are on the phone and can't see this site, it's ums.org/coronavirus/message-community. Let me say that one more time. ums.org/coronavirus/message.community. And again, there were several questions that we didn't get to. We'll see if we can find a way to provide some additional information in that regard. Again, please join us next week on Tuesday and Thursday as we talk about helping children cope and isolation, yet staying connected. You can use the same link, and it will be at 3 o'clock on those days as well. Thank you all once again on behalf of the University of Maryland Medical System for joining us this afternoon.